Hello, hello. Hey, I want to start by giving you all a small gift, because I know that it's middle to late afternoon. This is a huge gift. You all, can we all stand up for 1 second? This is a big gift I'm going to give you. We stand up, and I mean this. Stretch. We stretch. Deep breath in. Deep breath out. Oxygen has tremendous healing power and energy. One more time. Deep breath in and out. Cool. That's my gift to you. 1 minute. Hey, it's a pleasure to be here. You know, I thought at this time in the afternoon, after a long and brain-filling day, I would just talk a little bit about sometimes we choose industries, and sometimes industries choose us. And in my case, healthcare chose me. So I was at Georgetown University in Washington, D.C., doing my graduate work in law and business, and was diagnosed with non-Hodgkin's lymphoma 3 years into my 4-year graduate degree program. And so I woke up in an ER after having an EGD done, which is upper endoscopy, and I woke up and I looked to my left, and I had been engaged for 3 months, and every night during grad school, my fiancée would come home and she'd have these wedding magazines clutched to her side, and she'd be smiling and wanting to talk about table settings and food and all kinds of crap that I didn't want to talk about, but I'd pretend that I wanted to talk about it. And on this day, though, I woke up in the hospital, and I looked to my left, and there was Wendy, and she had her wedding magazines clutched to her side, but she had tears rolling down her face. And so literally in my head is, oh shit, the next 2 minutes is not going to go really well for me. And so I looked to my right, and on the right of my bed tray was a 4-color photograph that had spit out of the EGD machine. And on the photograph was a picture of the inside of my stomach, and there was a tumor about the size of an orange in my stomach. And so literally 24 hours later, I was in Baltimore at Johns Hopkins Hospital having surgery to cut about half my stomach out, and then waiting for about 9 days for pathology to come back. And when it came back, they told me I had non-Hodgkin's lymphoma, and we had to kind of begin chemotherapy immediately. And so I went through 5 cycles of what they call CHOP chemotherapy. And when you're CHOP chemotherapy is one of these traditional but aggressive regimens of chemo. And so the way my medical oncologist described it to me was, hey, other than your cancer, you're pretty healthy. So with CHOP chemotherapy, we kill all of your cells and hope the good ones grow back and the bad ones stay away. And if it works out that way, he said, I'll have a relatively normal life, but you just eat smaller meals and take all these crazy tests and sometimes sweat at night, and you're going to think the cancer's back, and you're going to come up to Baltimore, I'm going to tell you that it's not coming back, and all kinds of stuff. And so about a year ago, I was in Dr. Ambonner's office for my 10-year post-chemotherapy checkup, and he kicked me out of his office and told me I've officially graduated from his non-Hodgkin's program, and to only come back if I don't feel good. And so to that, we feel exceptionally blessed. Now, I would tell you during my cancer experience, I had a bald head with about 10 pounds lighter, and I had 1 more year of grad school when I was 4 into my 5 cycles of chemo. And so during my last year of grad school, we began to research and write about a concept called interactive patient care that, quite frankly, is more important than the company called GetWellNetwork that I started back then and still run today. And the concept simply said it's something that's easy to say but hard to do. If we can find a way to put patients and families in the center of the healthcare process and not on the outside looking in, the care will not only feel better to us as patients, but it will get better. And we should be able to measure that in the very outcomes that all of us are after. Everything from happier patients to healthier patients to lower readmissions to lower cost. If we can truly find a way to hardwire a new model of care through change management and through software to make sure that when patients receive care, it's not being done to them, it's actually being done with them, then the outcomes of the care will change. So that was the concept that we began our work around GetWellNetwork. We started a company called GetWellNetwork that simply said, we're going to go build tools so that our incredibly talented physicians and nurses who have been trained to deliver care without putting patients and families in the middle have actually some tools to kind of put in their superhero tool belts to deliver care in a different way. And so we've been at this for quite some time. I'll tell you one more story. I promise it's the last sad one, but about 6 years into my GetWellNetwork journey, my wife, Wendy, and I had twin baby girls. And we lost my little Macy after 19 days to a diaphragmatic hernia at Children's Medical Center in Washington, D.C. And I want to describe to you what the rounding process was like in the NICU at Children's. So at Children's, you come through 3 fortified doors. You got to check in 3 times to keep the infections and everything else out of the room because there's a very, very sick babies in this place. And so you get through the 3 fortified doors. You're in a bay, and there's 12 bays with very sick infants in them. And when you're in a NICU, the physicians round every 90 minutes. When you're in a med-surg unit, it's like every day, once a day. But in a NICU, they come around so often because the kids are so fragile. And so I was literally there for about 19 to 20 hours a day for 19 days because my wife was actually still in the other hospital with my other baby, Ava, who was in the other NICU. And so they were there, and I was at Children's. And so the way the rounding worked was this. So I was in the NICU staring at every turn of what they call an ECMO machine. That's a heart-lung bypass machine to see whether or not it began to work and could Macy get strong enough for us to do surgery on her heart. So I'm watching her through every turn of an ECMO machine for every one of the 90 minutes between when they would round. They would come in the round, and it would be about 3 physicians, 4 nurses, 2 techs, a couple residents, and they'd sweep by the bay, and they'd start barking out acronyms and writing things down as if I weren't even there. And what struck me so much is like, I'm sitting here for the 90 minutes that you're not in this room. You would think that I might have some input on whether or not the things that we're doing are either helping or hurting or what have you in this process. And so it woke us up to understand at GetWellNetwork that every time we think or say the word patient engagement, we better damn well say like patient and family engagement, because too often in healthcare, our patients are too young or too sick or too old or too afraid to be effectively engaged in their care. And so the work that we're after at GetWellNetwork is really kind of building a new model of care. We happen to call it interactive patient care, to really begin to turn the healthcare process on its head and to drive outcomes through engaging patients in the process. So they told me this might not work, so I'm going to see if it does. Wow, it does. So I just want to start by just giving you a little bit of a sense. So we exist for a really simple reason, and that is to help people take a more active role in their healthcare journey. It is a privilege to have a chance to share some of our work with you guys today. I was actually in Mobile, Alabama late last night, kicking off a new incubator thing that the mayor has going on down there. And I'm leaving here tonight to fly to Tampa on a red-eye. And I have an opportunity to spend a half a day with Mike Dawsey, and he's at the Tampa VA. And so we met Mike a couple years ago, and Mike lost all the use of his limbs the year after 9/11 over in the Middle East. And the last 2 years, we've been working with Dr. Scott, the neurosurgeon in Tampa, and Mike to make sure that we actually extended our application to enable patients with spinal cord injuries to also effectively engage in their care. So through GetWellNetwork, I don't know how it went backwards or forward. They told me this wouldn't work really well. Here we go. So through GetWellNetwork and through integrating the Sip and Puff devices into GetWellNetwork's tool, Mike is able to do everything from learn about the medications he's taking to let his nurses and doctors know in real time what kind of pain he is in, to actually playing chess with a friend of his who's a veteran, who's semi-retired military, who still lives over in Afghanistan right now through our tools. And that's really the why of kind of what we do. We have this unbelievable opportunity, and all of us do, to work in the biggest, baddest, most complex industry on earth. And at the same time, the work we do, it touches our neighbors and our moms and our dads and our children and some of the most important patients this country will ever actually take care of. And so we have a really easy reason to kind of stay up late and get up early and fly across the country 3 times a week. And we're just honored to have a chance to go do the work. So that's kind of why we actually do what we do. Now how we do it is the following. So Three things just want to give you some ideas around. One of them is a model, and I promise for those of you who are still studying, around, so I won't take you through and bore you to tears. I probably already have, but so we've spent the last 10 years understanding patient engagement from a clinical process standpoint. And so we are about to be, this quarter, publishing in a handful of medical and nursing journals a new model of care. And ultimately, this interactive care model will be taught, we believe, in medical schools and in nursing schools, so that all these fancy letters after all these amazing clinicians' names, there hopefully eventually will be an IC, acronym as well. And it really is around, am I certified to deliver care in an interactive way? Do I understand that by starting with the patient and starting with the patient's life aspirations, when we go into a doctor's office today, they say, what's your chief complaint? The forms inside of Epic and Cerner say chief complaint, and you fill it out. In this model, it's different. What do you want your health for? Not what is ailing you today. What do I want? Well, you know what? In 3 years, my daughter graduates from high school, and I need to be okay to be able to be up there at a graduation and walk her on the stage. Well, that's what I want my health for, and that's why I'm going to adhere to my diabetes protocol or my diet restrictions or my medications or what have you. So the model really says is, let's start with the patient's aspirations. Can health be a part of helping people achieve their life goals, not their health goals? And that's really where the whole model kind of begins, and we're teaching clinicians every day across the country, now across the world, on how to deliver care in different kind of ways. That's kind of the model. And then we've built a platform. We happen to, the concept is kind of get well anywhere. So whether you're in a hospital bed or you're coming into a clinic or you're back at home, can we become the integrated digital face on behalf of the provider to help patients navigate through their entire health journey? And that's kind of what we do. And when we actually do that, it kind of looks like this. So I might be, I don't know if I'm doing that, someone back. So I might be in a hospital bed, and I'm actually sitting on a television. And if you recall, so when I was at Hopkins, it was the craziest thing. Every morning I'd wake up, and I'd want my doctor to come in, Dr. Campbell, exactly at 9 o'clock, my surgeon, to tell me if pathology came back. But I never knew he would come. He'd come at maybe 4 in the afternoon or 10 in the morning. But the one person that come in my room every day, like clockwork, was a kid who had a Walkman on, because they didn't have iPods back then. He'd walk in my hospital room, and he'd ask me for $6 to turn the television on. And if I didn't have the cash, he would step on a chair and take a metal key, and he would turn off the TV. But when my law school roommate was there, I'd borrow the cash from him because I didn't have my wallet. He told me to bring a wallet, so I didn't have any cash. So I borrowed the money from him, and he'd turn the TV on, and there would be 13 staticky channels. And you had to go all the way back up and around and get back to the one you wanted to see. You could never go right to the channel. And so on day 7 of my hospital stay at Hopkins, I actually asked one of the nurses, hey, listen, I'm starting to get a sense from my surgeon that they might think this is malignant, and I'm probably going to start chemotherapy or radiation. Is there anything I can learn while I'm actually sitting here to go figure this whole thing out? She said, oh, yes, we have an education channel on channel 11. So I'm on 12, so I have to go all the way back up and around. It takes me 3 minutes. I get back to it, and I kid you not, there's a breastfeeding video on an education channel. And I'm literally thinking to myself, here I am at what is regarded as the world's #1 hospital on earth, about to make some of the most important life decisions in the most important life-defining moment of my life. And I watch, and a potential cancer patient is watching a breastfeeding video because the access to the resources from a patient-centric standpoint are a 17-year-old TV with 13 channels on it. It has nothing to do with me. And so the platform kind of really begins to kind of tie into the medical record. So we know at GetWellNetwork, we saw and took care of 5 million patients last year across the world. And we know what patients in what bed at what time. We know what language they speak, what medications they're on, procedures they're having, and what have you. And it allows us to kind of convert either an iPad or a television into a personalized, dynamic desktop for patient care, if you will, and really becomes the center of gravity for that patient and family's experience while they're actually in the moment, and then kind of following through. And then the last thing, I would tell you is meaningful use has driven the adoption of these patient portals. So you all probably have a patient, you probably have 4 different ones, because a lot of times your doctor gives you one, and the hospital gives you one, and your therapist gives you one as well. And so Act 1 of patient portals has been an abject failure. Enrollment's at about 4%. And when you enroll once, other than scheduling an appointment, you never go back, because the portals are built from an EMR perspective. So you actually hit lab results, and there's some PDF of some data you have no idea what it means. So why would I ever go back and look at that data if I can't even figure out what this stuff actually means? And so in GetWellNetwork, the third kind of piece of the puzzle is we call it My GetWellNetwork, and it really is putting a layer inside of the existing patient portals to really kind of bring our user experience work and our workflow work to life, so that patients actually want to go back and kind of live, kind of on these tools. That's kind of the second kind of piece of how we do what we do. And the third piece, when these things all put together, it really becomes, again, like a very familiar, consistent face for patients that allows them to understand, hey, what are my life aspirations? What do I want my health for? And based on that, what are my priorities, say, to deal with my health? And what may be other things I actually might use and utilize to kind of help myself be healthier? Now, from a software standpoint, we wrote a workflow engine that today interfaces with over 450 clinical and financial systems in hospitals and health systems all the way in the Middle East and all the way here across the country. And the reason we do that is because all these systems, what they're built to do is to help clinician workflow. But in our world, to say, hey, what piece of data might I be able to grab in real time that might help change the intervention for the patient and family at that moment? And so in a patient and family-centric world, a doctor ordering a medication through a Pyxis system or through Epic says to me, hey, I'm going to interrupt the reruns of Oprah and tell a patient, hey, Michael, you've just been prescribed prednisone. You should learn about this right now. If you have any questions, let us know, and we're going to let a nurse know. They can come educate you right this minute. And so that's the kind of things that we do all the time. And so the way these things end up looking are like this. And so this is a pain assessment pathway. So in our world at GetWellNetwork, a nurse comes into the point of care, they barcode a morphine pill at the bedside, they administer it to the patient. That's a trigger for our workflow to say, hey, every 60 minutes to get inside a Joint Commission requirement, let's ask a patient to assess his or her pain dynamically. Let's take that assessment of pain and let's make sure that if it's a 5 or below, let's just push it back into the chart. So I'm not requiring a nurse to go back 5 screens deep into Cerner and charting it. And simultaneously, if it's a 6 or above, let's also send it to a Vocera badge or a Cisco phone and say, hey, O'Neill in room 212 is in pain, please get to the room. So this is one example of a patient pathway of which we have a library of them to really drive a specific outcome around pain management or around readmissions or around satisfaction or around dietary services or what have you. And so that's really kind of the work that we're after. And I would tell you today, this is where our work begins. If there are any physicians in the room, you're probably familiar with, sorry guys, you told me this would be a challenge. I know I've said it a couple times. There we go. So this is actually a clinical pathway for leukemia. And this is where GetWellNetwork work begins. We would never claim to want to set the clinical protocol for heart failure or for leukemia or lymphoma. Our work begins here. So the providers that we work with across the country are giving us their clinical protocols, and our job is to turn them into patient and family absorbable pathways. You can imagine if I gave this to a new leukemia patient. They, of course, would have no idea how to manage and to optimize their outcome. But frankly, from a cancer experience standpoint, personally, this is what it actually sounds like to us. After the memo that says, WTF, you have cancer, it all of a sudden becomes like this. It could not possibly be more difficult for us to follow our protocols with the way that healthcare is delivered today. So we take these very complex things and we actually make them very simple for patients to access. And that really is the how of kind of what we do. And being that this is a business conference, I thought I would just give you also a snapshot of the what we do from a business standpoint. And so about 5 years ago, after we were kind of into our work for about 7, 8 years, this organization called KLAS, K-L-A-S, which really is a healthcare IT analyst firm. They cover about 155 healthcare IT segments, and it's a customer rating protocol. And if you go to the biggest trade show in health IT, it's called HIMSS in Chicago this year. If you go to HIMSS, everyone's going to have these best in class. If you actually win the ratings, you're best in class. It's a big deal if you're selling healthcare software to providers. You want to really understand what the KLAS survey is all about. And so about 4 or 5 years ago, KLAS picked up interactive patient care as a healthcare IT segment. And so today at GetWellNetwork, We are the market leader by size and by customer satisfaction for all 5 years since KLAS has covered interactive patient care. It's kind of the business, if you will. And so we sell our software to hospital systems and large providers. And when we do that, they're buying it on the promise that we make to them that we're going to help them improve their outcomes. And so the value proposition of GetWellNetwork is very straightforward. We believe that if we implement our model and our platform and do the right change management work with your clinical staff, you are going to see improvement in your patient satisfaction scores that now impacts reimbursement, in your quality indicators like falls and readmissions, as well as in your operational efficiency. And so the value proposition of patient engagement for us is patient engagement is not an amenity. It's a core strategy for health improvement, and we're going to go prove that. That's kind of what it is that we do. And I'll close quickly as I'm seeing my time be at 0. Hang on. This is challenging. That's why I actually got to stretch. Well, I'm going to give it a minute. I'm just going to I'll finish with an invitation. We launched an incubator about a year ago and bought our first 2 companies last year. There's amazing innovation kind of going on. We have about 200 organizations across the world who are starving for breakthrough patient engagement innovations. And that's what the company is up to kind of doing. So I appreciate y'all kind of letting me be a part of the event, and have a great rest of the day. I'm sorry for the technology glitches. Bye-bye.
Thank you, Michael.